This goes for all nurses, but oncology nurses are going to be tapped into because when our servicemen and women go to other countries, they're exposed to chemicals and dangerous toxins that can then lead to cancer. And so with the limitations on the VA, the community health centers like MD Anderson are being tapped into to treat veterans in the community. And so what I would recommend for nurses in dealing with veterans, whether they're homeless or not, is that they have been trained and educated to respect each other, to rely on each other, and to fight for our country and to serve our country. And in that respect, they look at nurses and healthcare providers with a higher level of respect, but they expect to be treated with respect as well for what they've done for our country, giving up their bodies, their minds, their souls, their hearts to our country and coming back damaged or injured. They expect that respect to come back to them, and they don't often tolerate disrespect. So they want eye contact. They want to be treated like a human being, especially those who are homeless. And what I love about the homeless is that they are, I refer to them as equal to any of the rest of us. They have needs. They have people who love them, who care about them. And for whatever reason, they have landed on the street. I always say that we are all one major medical issue away from homelessness. And so we all need to have a plan. Even though I think that my children would bail me out and help me, I still have a plan. And so we all need a plan. But nurses can absolutely do this. They can take care of the homeless. They can take care of the veterans, because this is what we do and this is who we are. The American Academy of Nursing has published a book called Caring for Veterans. And that would be a great resource for people, for nurses wanting to know how to better care for veterans. And I contributed chapter 20, which includes my grounded theory, an explanation of how that works and the factors that influence veterans who are experiencing homelessness and what led them to that. And we've touched a little bit on that, but it also talks about resources that are available for them. So I would recommend that they look at that. I am working with a group of fellows from the American Academy of Nursing to write scopes and practice for nurses working with military veterans. We're developing that currently. So that will be coming out within the next year. And so you can be looking for those. But I think that the big thing with veterans is just to see them for who they are. And like I said, to respect them. So they will be calling the nurses ma'am or sir. And there's nothing wrong with calling the veterans, asking the veterans, of course, how do you want to be called? What name do you want to use? Because some of them still use their officer designation, and they do want to be, like if they're a gunnery sergeant, they might be called gunny. But they do have preferences for what they want to be called. If they're older, they're probably going to want to be called by their last name. And I think we've gotten away from that a little bit, but that is another sign of respect, and it needs to just be considered. So we need to just ask them what they prefer, and ask them in any way what they prefer. Tell them which we do as nurses. We explain what we're going to do before we do it. We ask permission before we do it, and we involve the patient and their family. And so I think that those just things that we do, we just need to make sure we continue doing with veterans, whether they're homeless or housed.